are disconnected. Operations MA14. Take any port. You have a 38-year-old female unresponsive, shallow breathing, possible overdose.
That's your seat, we're around.
Be advised, you have fire department on scene confirming this is going to be a heroin overdose.
Drug overdoses are now the leading cause in deaths among Americans under 50. First responders, emergency personnel, and law enforcement are on the front line of this battle, responding to the increasing number of overdose deaths from Fayette to the Mon Valley areas and nationwide.
Like, I know every shift that I come to work, at least one time in that day, I'm going to give somebody Narcan. And it's sad. It's sad. Honestly, to me, it's sad to watch them just repeat the same mistakes over and over. And then you see the family a lot of the times on scene, and you see what it does to the family, and then, you know, you get a death, too, because you can't save everyone. And watching the reaction to the family, because you're not only hurting yourself, you're hurting everyone around you.
It's every single day somewhere. If not here in Brownsville, in Uniontown, or Connellsville, or Masontown, somewhere, anywhere.
You never thought we'd be getting into that. You know, you go to a medical call, you figure you'd be doing CPR and giving people oxygen, or, you know, patching up a cut on a leg, or somebody twisted, you know, maybe fell and broke a arm or something. Now it's, you know, most of the time it's, you know, majority of them are overdoses, our medical calls.
Within the last couple of years, it was, you can really see the spike, because it seemed like we were going to a lot more on a midnight shift.
For the most part, prescription painkillers and heroin have been largely responsible for overdose deaths. However, synthetic opioids such as fentanyl and carfentanil, which require multiple doses of Narcan to revive a patient, are causing a surge in fatal overdoses.
You are seeing stronger and stronger drugs out there. Where it used to be 2 milligrams would wake somebody up. Now we're pushing 6, 8, 10 milligrams on these patients that's on heroin and fentanyl.
Carfentanil is a narcotic that's many, many, many more times stronger than morphine. You know, there's a street name for it. They call it the Gray Death, because a lot of the victims who have fatal overdoses take on a gray tone to their skin, so they call it the Gray Death. And it can be absorbed through the skin, and that's the scary thing.
You know, we just start, everyone wear gloves when they're packaging evidence, you know, may get to the point of wearing masks. I know there's been a few incidences. The one was in Washington Township, the one in Westmoreland County, I believe, and then that East Liverpool, Ohio, where both the officers had to be Narcan. You know, one was searching a vehicle, one was just had something on his shirt and didn't realize what it was. Brushed it off, and yeah, I mean, it's scary.
Because we really haven't had a definitive carfentanyls here, you know what I mean? And we've had a coroner's report of one issue that was carfentanil, but you know, there was no real definitive. Yeah, and he's going on an overdose right now as we speak.
We're only assuming, because I have no way of knowing, with a polysubstance abuse, which means it was something other than an opiate or along with the opiate. Considering she did respond to the Narcan, her ventilatory status improved with the Narcan, but she still wasn't neurologically, like, there.
Calm down, it's Trisha.
The one that we just had was a relative of mine, a family member. So that is frustrating. I think it's sad because it's like, to me, it's like playing Russian roulette. You don't know what shot's going to kill you, but eventually one of them will.
The increase in overdose calls are causing a financial, physical, and often emotional impact on first responders.
You know, when you see a mom that is blue and not breathing, and her little 6 or 7 year old watching you work on them, and you're doing everything you can to get them back, and they're watching the whole time. You only see that a couple times, and it takes a toll on you.
There's nobody that's beating down the door trying to work on an ambulance, for making the same wages that you can potentially make at, restaurants, to deal with the overwhelming, at times, stress and things like that, and it's not emotional stress sometimes it's just physical stress.
We went to this house 10 or 11 times, and on the 12th time, we didn't get there in time. He's dead now. So we've had the repeats. It's a strain on our people. It's a strain on our resources. It's a danger.
So in that aspect, although we're willing to go and do our job with no questions asked, it gets frustrating whenever you have to go to the same residence in a 2-day span for the same situation, and you're depriving the rest of the citizens in the community police services.
I'm tired of giving these people nothing except for, it sounds bad to say I'm not doing anything but saving their life, but I feel like it's just not enough. Like it's just bad, And the ones that we can't get to, they're farther and fewer between, but they're getting more regular. We're just, I don't know where it ended. I don't know what they've had summits around Penn State, different churches. What do we do? What do we do? What do we do? I'm not that guy, I don't know what to do. But I can tell you right now, what we're doing ain't working. It's not working at all.
I think the intent of the law of the Narcan on the surface was good, but we've became enablers now, knowing families can have the Narcan, everybody, so if their kid gets in trouble or they go have a Narcan party or whatever, so we've became actually, instead of just to be able to treat somebody in the short term until they get treatment, we've became enablers somehow in the midst of this. And I'm sure that wasn't the intention of the legislatures. They were looking at the part of people are dying, what do we do? Here we have this stuff, but it's just a tough thing every day.
Under the state's Good Samaritan law, people who overdose are protected from prosecution. However, that law might change soon. House Bill 1501 was recently proposed and would force someone who overdoses to enroll into a drug treatment program or instead face charges.
Overcrowding prisons is a big problem, and I think that's why. But we have to have effective treatment. That's it's just because it's court order doesn't mean somebody really is ready for treatment. I've seen that happen time and time again. So
you hear a lot, just let them die. I can't let anyone die. That's not my job. I'm here to help people and save people, and that's where I really think awareness, and empathy, and compassion, that goes a long way.